This is urinary system, CPT 2020 urinary. Again, starts with your index. Does have good pictures of the urinary system. Just like in the respiratory, musculoskeletal, this organ system will start at the top of the organ system and work down. So it starts with kidneys, goes to the ureters, and then the bladder, and then the urethra is last. So we start with the kidney. Has good pictures. Kidneys have multiple parts to them, and each part of the kidney has a different function. Several problems that you can have with your kidneys. Probably one of the most common is stone removal or stones. So you have incising of the kidney, excision. So this is open procedures. Renal transplant. Again, transplantation, just like with the other organs, very, very specific. So make sure you're looking and reading thoroughly through here what's on the cadaver side and what's on the what's a living donor. Cadaver donor versus living donor. We've got an introduction section. Remember, our introduction is our catch-all. Renal pelvis. That's specific to the kidney, a part of the kidney. But those are specific catheter placements into that area. Then you have some aspirations, installation, dilation, still within that introduction section. Just a lot of stuff in here. Your nephrostomy tubes, conversion of nephrostomy tubes. Then we get into repair. Pylo, that means kidney or renal. That's it. That would be a prefix. Then we have our laparoscopic procedures. Remember, you always know your body part and then always know your approach. That at least gets you thinking and in the ballpark. Endoscopic procedures. Lithotripsy, that's where they use shock waves, sound waves in order to break up the stone. Under code 50592, there's a parentheses. Remember, I'll remind you again, parentheses are vitally important to CPT. Always, always read them. Even when you know you have found the right code, read the parentheses under them. So here, this says for image guidance and monitoring C, and there's 3 different codes. One of the codes is for ultrasound. One is for CAT scan or computed tomography. And then I don't have this one written because I don't know why. It's probably fluoroscopic, the 77022. For some reason I made notes on, or it could be just a different version of the CT. But I made notes here so that I would readily know that the image guidance, if we're looking for ultrasound, then there's one specific to that. If we're looking for CAT scan, there's another one. I just make little notes like that. They just help me. Okay, so we're out of the kidney and into the ureter. There's mirror image of them. So you have your left and rights. They are the long tube that connects the kidney to the bladder. There, you can see in this picture, the ureter dumps into the bladder, and then there's 2 openings on either side, and then an opening at the bottom of the bladder. If you were to draw an imaginary line to connect all of those holes, that would be called the trigon. It makes a triangle, and that's the trigon area. So as you read stuff, that may help you in knowing specifically where in the bladder they're talking about. Maybe they've got a transitional cell carcinoma of the bladder, very, very slow growing bladder cancer that you can have for 20 years and go in and get affected parts taken out a little at a time. Okay, so ureter. So we have incision and biopsies. of the ureter. This is vitally important that you don't get urethra and ureter mixed up. Excision. And then we have introduction section. Again, this is going to be the funny placements of maybe a ureter stent, maybe a change of a ureterostomy tube, sorry. And just different stuff could be in here, maybe dyes or injection of something. Then we have repairs. These would be open. That would be the approach. Then we have our laparoscopic approach. Then we have endoscopy. So that's kind of consistent. If you have your body part and then you have your action, then you're able to at least get in the right area. Then we get into the bladder, incision, excision, introduction. I do have a note here, code 51700. This is a bladder irrigation. You're only going to code this if it's an independent procedure. So if they're doing what I call a big dog, something else, and happen to irrigate the bladder, you're not going to code for that. That's going to be bundled into something bigger. So that I must have written that probably years ago and then just carried it over because it caught me. I had a scenario that it caught me in and I had coded extra for it and I shouldn't have. Urodynamics, this is measuring lots of things. How much residual urine. Maybe someone's having a hard time emptying their bladder. They have something neurogenic going on with their bladder. So the nerves aren't feeding the bladder like they should, or the nerves are not coming back telling their brain like they should. Something like that. Pressure and voiding, different stuff like that would be in here. Then we have repair, bladder repair. So the very first one, 51800, cysto meaning bladder, plasty meaning repair. Laparoscopic for the bladder. Then we get into probably one of the most heavily used sections of the urinary system. This endoscopic area has all of the cystoscopies, uretherostomies, cystourethroskopies in it. So say you are that patient that has transitional bladder cancer, transitional cell bladder cancer. They're going to use a cystoscopy or a cystoscope to instill tuberculosis into your bladder, to use a tool to scrape out a lesion, to biopsy. The cystoscopy scope is the way that they're going. That's the mode of transmission or mode of activity, how they're going to get to into your bladder, what they're doing. So you're going to find a few diagnostic type of procedures, and then you get straight into the surgery or the real fixing, trying to fix the problem. So the biggest thing in here, probably just high level to think about when you're sitting for the CPC board. Unlike the colonoscopies and the EGDs, you cannot stack a regular cystourethroskopy with a surgical. Just like, remember, we couldn't stack a diagnostic EGD with a surgical EGD. So think of this code 52000 as a diagnostic. This is simply placing the scope into the bladder, going up through the urethra into the bladder. So if you look, it makes sense that say code 52204, this is a cystourethroskopy with a biopsy. So it makes sense that you would not code a cystourethroskopy with a cystourethroskopy with biopsy, because then the doc's going to get paid for two scopes. Well, he only did one. So this is a prime example where that separate procedure really plays a heavy role. So if you have documentation of something being done during the cystourethropy op report, you're not going to code a separate procedure, cystourethropy. Make your notes, do whatever you need to trigger you to remember not to do that. But your separate procedures are never coded with an actual big dog procedure unless you can determine that they are separate and identifiable and can put a 59 modifier on them. And if this is the same scope that this is, it is not separate and identifiable. So your boards will probably have at least one question, and they will try to, in your choice of codes, they're going to try to mix in this 52000, maybe even put a 59 modifier on it, maybe a 51 to even make it less obvious. Do not mix a cystourethropy with another cystourethropy. If you have multiple things being done, stay over here in the action in the surgery section and stack them that way. Okay, I go through here and I underline my urethrotomy. So that's cutting into the urethra here. Whereas, okay, so this is all urethral. And then down here, 52290 becomes ureteral. So that's your ureter. So these are two different body structures. I have to underline them so that I see them, because when I'm stressed, I've read a scenario and I'm not even comfortable with what I'm looking for. Nut cutting between, oh, that's probably not nice. Choosing between two words that are so closely spelled, my eyes may not catch it. And I may get it wrong simply because that kind of careless mistake. Code 52310. 52310 uses a 58 modifier. If needed, if it's applied. But I just put that because, remember, I'm not good with my left and rights, and I'm not good with my modifiers. I know all my modifiers, I'm just not always good with including all of them. Same thing with 52318. This is also one that could have a 58 modifier, could have that used. Now we get into the ureter and pelvis. Now remember, we're still in the transurethral surgery. We're still doing cystourethropes. We're still taking a scope up through the urethra, male or female, doesn't matter, into the bladder. We're still doing that. Now we're going even past the bladder, up one of those ureters. So we have the trigon area. We've come up through the bladder. Now we're going up into one of the ureters. Good guidelines that always tell you what you can and cannot code in additional. This is telling you what could be already bundled in, what's included. I always take that and rewrite it because sometimes I'm lazy and I don't want to read all that wordy stuff. So my notes usually save me. I know how I am. Some people may be really good at reading this stuff and they remember it and have good recall and don't need to make notes. I'm a noter. I have to. I got sticky notes on sticky notes. I live by sticky notes. So these procedures will include a temporary stent, insertion, and or removal. If that was done, these will include it. Your 52352, this is, you may see this as a basket procedure. I just put basket beside there. Your 52353 is your lithotripsy. So that's your shock waves. Now we're getting into male only. Vesicle, neck, and prostate would be male only. The other stuff was unisex. Doesn't matter, male or female. This is just parts on a male. These TURPs, transurethral resection of the prostate, is what TURP stands for. And I put that That's TURP right here. But there's a little bit different variation to them, so I have to do some underlying to determine that. All of these probably will involve a rectoscope, or could, I better say that, could involve a rectoscope. That would be the same scope, but it goes up through the rectum instead of the urethra. Rectoscope. So this is an electrosurgical resection of the prostate. Tells you all the stuff that it involves. For different approaches, here's your parentheses again. For different approaches, it gives you other codes to look at. So if this is not using a scope, if your procedure is an open procedure or some other different type of approach, go someplace else and find it. Your 52630, this is the tricky one. Remember how in cardiovascular and in, I think, digestive, we did too, had some reoperation of stuff, or in a lymph system. This is a reoperation. So this is a TURP, but it's for residual or regrowth. So potentially not all of the prostate tissue was taken out, so it's regrown. Or not all of it was taken out. They knew it. Maybe they just took, maybe it was, which would be hard to believe that they would do, but maybe they took a portion of, or mistakenly left a few cells, and there was a residual that there in fact did still have the cancer in it. So that would be the two scenarios. So just know the difference here. Know you have different approaches. The book usually will give you all the answers you need if you read it and understand what you're reading. And so practice makes perfect. Then we have laser destruction of the prostate. That's very specific. Okay, so then we get into urethra. We're back from just male into either sex. Doesn't matter, male or female. So we have incision of the urethra, excision of the urethra, repair of the urethra. There are, believe it or not, sling operations to help with urinary incontinence for males and females. Females are used to it. We most of us give birth, and it somewhat displaces or stretches out ligaments for several of our organs. So there is a sling operation, 53440 for a male, and then there's sling operations for females. So in here, really make sure what you're looking at doesn't say for male and your patient's a female. You won't get through, when you submit that claim, you won't get through NCCI edits or through your clearinghouse, because it'll be a code geared to a different sex. And there's males and there's females. So then we have manipulation. This is probably most likely a dilation of the urethra, but it can be male or female as well. Okay, then we have a transurethral destruction of prostate tissue, very, very specific to either the microwave thermotherapy, radiofrequency thermotherapy, water vapor. You would have that and be able to plug that in. So that's kind of stuck in here. Eventually, I think it'll get probably in mainstream or not in other procedures, but for now, that's where it is. Okay, so that's the urinary system. So let's do a few examples. So let me get my paper out. Unless I hear differently, I'm going to keep doing it this way, because for me it would probably help, and at least you can see what I'm writing down as well as me reading it. Physician made an open incision and inserted multiple tube drains to drain an infection abscess of the kidney. So kidney is going to be, that's our body part. So he did an incision. That's probably where our action is going to be. And it was open. Incisions are open. And there were multiple drains. And I'm not sure if we're going to need to know that it was for infection or not. We'll have to look at that. For a diagnosis code, the infection diagnosis code would certainly support or or the abscess would support this procedure. So, but from a CPT, I don't know if our code's going to say infection or not. So let's look. So I know kidney, so I'm going to start with the kidney. I'm going to do an incision and see if I can find anything under incision. So 50020, drainage of perirenal or renal abscess open. So that's it. I think that's it. I am going to just go on because I'm never sure. I want to make sure. So here, I do have a parentheses underneath here. These pictures really mess you up with that kind of thing, so really be careful. For percutaneous image-guided fluid, okay, we didn't do all that. And then we're into nephrostomy. And nephrotomy and nephrolithotomy. Okay, we are good. That is our code. Okay, so let's try another one. Physician removed a kidney stone by making an incision in the right kidney. So we have a kidney. We have an incision. Did I spell that right? Yep. And this is for a stone. Not sure if we need to know that or not. So let's see where we're at with this. And it was, he made an incision into the kidney. So kidney incision. Let's see if we can find it under here. We'd already made it nephrolithotomy, removal of calculus. So we're under kidney incision and we had a stone. Nephro means kidney or renal. Lithotomy is a stone, or litho is a stone. Otomy, incision, removal of a stone. So that's our code. See how that medical terminology plays a role now? To this day, I've been in the medical field probably close to 30 years now. And I still sit and break my words down. I'm telling you, it's like changing the diaper on a baby. You just have to do it 10 times a day. That's just how I do. Okay, let's do another one. Interventional radiologist inserted a percutaneous nephrostomy catheter into the right renal pelvis. So there's our body part. Renal pelvis. So this is going to be percutaneous. What all did I say? Percutaneous nephrostomy. So let's look at that word a minute. Nephro means renal. Ostomy is a creation of an artificial opening. Inserted a percutaneous nephrostomy catheter into, this was the right renal pelvis. And since there's mirror image of both kidneys, you got to have that down. For drainage, fluoroscopic. So this was for drainage. And they used fluoroscopic guidance. So here we go. So let's get to our body part. So here starts our renal pelvis. So I'm just going to internally dwelling. We don't have anything already internally. We're going percutaneous from the outside in. So externally accessible. This is maybe getting us closer. Other injections. They didn't inject, they drained. So let's see here. Placement of nephrostomy catheter, percutaneous. Okay, so we just got those. Including diagnostic exam when performed, imaging guidance. So there's our fluoroscopy, it even says it. And all associated radiological supervision and interpretation. So I think this is it. What it didn't end up giving us is that drainage. So see, sometimes it does and sometimes it doesn't. So 50432, and I would put an RT on that because we know that it went into the right renal pelvis. I would put an RT. I'm going to read my do not codes 50432 with all this other stuff, but I didn't. Do not code 50432 in conjunction with, and I didn't. Okay, so this is, let me read. This is a nephroureteral catheter. So this is going into the ureter. This went into the actual. Perfect. Okay, we got it. Okay, let's do another one. Physician revised a surgical opening between the skin and the right ureter. So, ureter is our body part. So they revised. So our code may tell us that have something about a revision or a reopen or something. We'll have to see. Let me read it again. Revised a surgical opening between the skin and the right ureter. So let me put right. So I don't know. This one's odd. Let's see what we're going to be looking for. So let's get to our body part first. Let's get to our ureter. So here's our ureter. And we are doing a revising, makes me think it's a repair. So let's start there. So ureterolysis. Lysis means freeing. So those would be adhesions on the ureter. Ureterolysis. 50727, revision of urinary cutaneous anastomosis. So that's it. So that's skin to ureter. That's what that is. So skin is cutaneous. So it's urinary, revision of urinary. So that could be ureter. We're under ureter, so we can make that assumption. Anastomosis, remember that's taking one end and sewing them together. So this would be 50727. And we better put our RT. Don't let me make you forget that. Okay? Good job. Okay, let's do another one. Physician performed a transurethral resection of a post-operative bladder neck contracture with resectoscope. Okay, so we've got a bladder as our body part. This was a transurethral. Sorry if I don't spell those right. Resection. Resection is also a word for excision. Post-op, I don't know if we're gonna need to know it's post-operative. Bladder, neck. So that's specific, and this is a contracture. So that's where some of the if you have a contracture, you see them a lot in older folks. They get contractures of their fingers, arms. They freeze. They freeze in the muscles, tendons, ligaments freeze. So they've gotten some kind of freezing up of the bladder neck. So let's get to bladder. Oh, they used a resectoscope. So I'm just going to put on here scope. Okay, so bladder neck. This is bladder itself. So they used a scope. So I'm going to get under my scopes and under my surgery and try to find my bladder neck, maybe. Vesicle neck. That's not necessarily going to help me, but maybe. Let's see. So transurethral. So Here we go. So so this puts a lot of information together. The right code this is probably a male patient. They should have told us that. You would have that in your chart. It bothers me when they don't tell us stuff. Hold on, there we go. Sorry, my computer seemed to flip out a minute. Okay, so let's walk through this. We're doing a transurethral bladder neck. So we have a bladder neck contracture here, post-operative, but it's indented. The right code is 52640, but we're going to walk it backwards. So this gave us post-op. This gave us our bladder neck contracture. And so this transurethral resection, post-op, we know they've already been in there because they had to have been operated on before to have a post-op complication. So this is all underneath a redo. So we're going to take 52630 to the semicolon, which is just transurethral resection right there. Not worry about the rest of it. And then go here. So the whole code would read transurethral resection, semicolon, of postoperative bladder neck contracture. And that maybe doesn't have to be a male. I don't know, it could be a female. Just that. Maybe the female had some kind of bladder surgery and that happened. But that's probably about the only combination you're going to get in here that doesn't. I don't know. Here's a transurethral bladder neck procedure, separate procedure. So that could be male or female too. Never want to make a blanket statement. That's what I can tell you. We just learned that from what I did. Okay. Let's do one more. Physician inserted a cystourethropy scope through the urethra to drain an abscess on the prostate. So this is a cystourethropy. I'm just going to shorten that so you don't see me write out all that. Through the urethra. So that's a normal way that we would do that. And going to drain an abscess of the prostate. So we know we're going to be in our scope section, in our surgery section. So now we've got to find the prostate. So we're under the prostate. So now we need the transurethral drainage of an abscess. So you just have to kind of, most of this is your TURPs. These are incisions. Here, 52700 is your transurethral drainage of prosthetic abscess. So that would get it. Okay, very good. That is the urinary system, and I'll see you in the next video.